There we go.
Okay.
We are recording. Good
Good
morning, everyone,
morning.
and to our replay audience. I am Dr. Shanae, the Executive Director of the Collective Wellness Institute, and this morning I'm super excited to share time and space with Caitlin McGuinness. And so I always ask for like a brief write up, and then I realize that each time I start, I'd rather hear you tell who you are. So why don't we do that? Why don't you give the audience a little understanding of who you are and what you do?
Okay. Are you looking for who I am professionally, who I am personally, or kind of a mix of both?
Give me a mix.
Okay. Well, I'm Caitlin, and I am a licensed mental health counselor, and I always get anxious when I know I'm on like a live recording. I am a wife, a friend, a daughter, a sister, a dog mom. I
Hmm.
I'm more than a dog. I'm a dog mom, a cat mom, and a hedgehog mom.
Oh, hedgehog now. Okay.
So we have four pets. And I am a very passionate therapist. I'm really, really passionate about working with young people. So in addition to, I'm so sorry. I have to make sure that this is the dog that's eating is the dog that's meant to be eating.
No problem. And
Okay.
she said she's the dog mom, and they have
So
minds of their own.
one of my dogs just had surgery and the
Oh no.
medication is making him like ravenous. So he's
Oh
been eating our other dog's food and I was making sure it was
no.
okay.
Oh, no worries. No worries.
So yeah, I'm really passionate about working with young people. So in addition to being a therapist that specializes in teens and young adults, I also volunteer with an organization called the Hugh O'Brien Youth Leadership Foundation, and I've been volunteering with them. It's a youth leadership seminar that happens every year, and I went when I was 16, and I've been volunteering with them ever since. So that's a big part of my life as well.
That's pretty awesome. I don't know that I've ever heard about that.
Yeah,
You
I
said
wonder, I'm sorry.
Hugh O'Brien.
Yeah, so Hugh O'Brien, and it's the acronym that it goes by is Hobie, so HOBY. So it's more commonly known as Hobie.
Awesome.
Yeah.
So a little bit about our connection. Gosh, I think you were my first supervisee. Were you my first? You might have been my first supervisee.
Wow.
You
You
didn't
started
know
off
that?
strong.
Yeah, yeah. I had a good one too. I think when did we start?
It was 2017,
Yes, yes, yes. Um, 2017, you got licensed in
2018.
18 because
Mhm.
you relocated from up north, I thought.
Yeah, so I'm from Florida, born and raised, but I went to Florida State University for undergrad. And then for grad school, I ended up going to Ball State in Indiana. And I stayed up there for a year working. Up there they call it a an associate therapist.
Hmm.
So I did a year of that, and then I came down here and finished my second year with you.
And you started working for a local organization. We won't call them out, but you started out working with young girls.
Yeah, yeah. So I worked for a nonprofit that specifically treats young girls like from 11 to 17. And so I was in a school setting working with middle school girls who were struggling with their mental health.
Very good. So I love to ask, what drove you to become a therapist?
You know, I've thought about this a lot, and um, I guess I have a couple different answers. So one is I've always been very, very passionate about service and helping others. So when I was younger, I was always doing volunteer work. I always got a lot of joy from doing volunteer work and helping others. Like it really it feeds my soul to know that I'm helping someone or an animal. And so that was always something I was really passionate about. And I was like, okay, like, could I make a career of this? And I also have always been the friend that people come to for, advice or just a sounding board. And so in high school, because I also really wanted to be an actress and a model when I was younger. So that was like my focus in high school. And then I was like, okay, like, is this realistic? Maybe I need to think about how I could take my passion of service and my talent of being like a great listener and combine them. And then I also have, I don't know why, just I've always been very passionate about helping survivors of sexual abuse and assault. So in high school, I kind of decided like, this is what I want to do. I didn't know the different terms, psychiatrist, psychologist, therapist. I just knew I wanted to work in mental health. The other dog is eating. 1 second.
No problem.
Okay, sorry.
No problem.
Um, so I remember I was really passionate about service, being a good listener, helping survivors of sexual assault, and then I decided, okay, I want to be a therapist. So I went into college knowing without a doubt that's what I wanted to do.
I love it. I'm not surprised at all about the actress and model aspiration. I mean, you have the stature for it. You certainly,
Oh,
you
I am
certainly,
very tall.
you, but you also have a very attractive presentation. You carry yourself well. You're very stylish. I mean, I've been around you long enough to, just kind
Thank
of
you.
observe those things about you. And I think that that lended itself very well to you working with young girls. Um,
Mm-hmm.
you you don't present as what's the word I'm looking for? You present as someone they can aspire to, right? Like if I work with yeah, I don't work with young people anymore because at this point I just feel like I'm old. I feel old and disconnected from like the world that they are in. But your youthfulness and the way that you carry yourself has been a great example for young girls to look up to reach for. There's one particular scenario that I remember, and I don't remember the specifics about it, but when I mention it, I'm sure you will. There was a point in time when you went on a collection, like you started collecting like beauty items for girls.
Mm.
Do you remember
Yeah.
what that was about?
Yeah, so I was in the school I was at was a Title I school. So the majority of the families I worked with did not have access to a lot of resources. And my mindset was, why stress them out anymore? Like, if I can do something to reduce the stress of a family I work with, I want to do that. And so I was really lucky. The school that I was at was so great to partner with, and they gave me a massive office. When I say office, it was a classroom. So I had an entire classroom as my office, and so I had these huge like closets, and I decided to make my office a store. And so I filled the cabinets with toiletry items. So I had pads, tampons, shampoo, conditioner, skincare, toothbrush, toothpaste, floss. And then I had fun stuff too, like body lotions and makeup and stuff, nail polish. And then on the other side, I had racks of clothes. So I had a whole store where my clients could shop, right? And at the start of the school year, right before the school year would start, I would actually have a shopping day. And I'd like play, I would turn it into like a little boutique, and I'd play music, and it would be separated by like jeans and shirts and athleisure and stuff. So that was really cool. And I did all of it was donation based. Like I got so many donations from people in my community. And then
Yeah,
once the teachers at the school knew what I was doing, they would bring me stuff.
I love it.
So it was really great. And what was also a nice touch is on the, middle school, high school, like sometimes you have an accident when you're
Yeah.
menstruating. And it was so
Mhm.
great because they knew that they could come to my office and they would have replacement clothes.
Yes, I love it. I remember that really profoundly because you were pretty, it was it was above and beyond what you were called to do as a counselor. It was well beyond what the organization that you worked for was doing. And it said a lot about your commitment to that population. And does any of that translate now? Because you no longer work for an organization, you're self-employed, you're in
Mhm.
private practice. Are you able to, or do you find yourself innovating in that way or similar ways or different ways now in private practice?
So it's very different. The population I work with now tends to have more access to resources. So I don't have like a shop where my clients come and get things like that. But I do think I have I'm very cons the dog is poking me with his cone because he's the
Mhm.
surgery. I really enjoy giving, and I know that some therapists have the mindset that this is crossing a boundary, but one of the things I really love to do for my clients is when they are graduating high school and they're going off to college, I try to just do something small to represent
I
that.
love it.
So like something like a little plant that they keep in their dorm room,
Hmm.
or um one client in particular is going to be pursuing something in the culinary arts. And so I was able to get them a cookie cutter that's in the shape of the college they're going to be going
Oh,
to.
wonderful.
So I feel like I still do that little special touch, but I can't do it to the same degree that I did before because also my office is actually the size of an office now.
Gotcha. Absolutely. No, that's interesting that you mentioned the different access between the organization and the being in private practice. And I think for clarity, for the sake of clarity, understanding that the organization that you worked for served a lower SES demographic. These were young girls. Were they at risk? I think they were at risk.
So yes, but the language that we used was at promise.
I
Um,
promise.
but yeah,
Okay.
the general population would say like at risk, but really it was yes, it was a lower SES, but it was also just, a lot of family histories of trauma, just
Mm.
cycles,
Yeah.
generation after generation
Yeah.
of trauma and substance use and lack of access to resources. So, and then a lot of the clients ended up, suffering with depression, anxiety,
Yeah.
PTSD, things like that.
Yeah. And now as a private practitioner, the individual, you still serve women, right? Young girls.
Yeah, so I specialize in ages 12 to 30, and I don't say that I only see women, but that tends to be who seeks me out. So the majority of my clients are women or gender diverse clients.
Okay.
I don't put this on my website as a disclaimer, but I typically don't work with boys under the age of 16.
Understood.
Reason being, I've tried it and I find that younger boys don't respond well to my approach. They would prefer to do more play-based activities like video games and things like
Hmm.
that. And again, this is a generalization, but
Sure.
most young boys don't love talking about their feelings. They would like to be doing it in a more roundabout way. And I
Hmm.
get right to it. We're going to talk about feelings and we're going to connect
Yes.
your feelings to your thoughts and your behaviors. So I've just found that there's a maturity that young boys seem to reach around the age of 16 where they actually do click with me.
Understood. That's good. That's good insight. Um, I want to ask, what is one of the greatest lessons you learned about yourself along the way?
Um, I think that I learned that I'm good at this.
I love that.
I started out working with adults and I was in a community-based mental health agency. Technically, I was working in an opiate addiction treatment team, but I would say I had a diverse population. So I was working with, anxiety and depression all the way to severe, severe schizophrenia, psychosis. And so I thought, okay, this is what I'm going to do. And then when I was looking for jobs, when I was getting back down to Florida, my very first job was actually working with adult males.
Oh,
It didn't work out. And I got this job with this company that working with young women. And I remember going, can I work with teenagers? Like I don't have any experience in this. And wow, like it is 100% my calling. And I think that I've just realized like this is what I was meant to do, and I am good at it. Another thing is it's scary leaving an agency, leaving a salaried position and going off on your own and doing private practice.
It is.
And there's always imposter syndrome. Like, am I actually good at this? I mean, I've always dealt with that. Like, I could have straight A's and I'd be like, am I really good at school? I don't know. Um, and I remember just thinking like, can I do this? Like, can I actually like have like a full caseload? Like, are people going to want to work with me? And
Yes.
I've been so blessed, and private practice has gone so well. And I think that it's just helped me realize like I got this.
Yes, yes. I remember when you became licensed, and I always ask, okay, so what's next? And at the moment, I don't think you saw private practice as any like tangible in that moment. So
Mm-mm.
I think you held on to your position for at least another year or so.
Yeah, I left in 20, oh gosh, was it 2021?
Oh,
2021.
several years. You held on for several
Yeah, I
years.
was there for 4 years. And I'll tell you why. Because I had a lot of people pushing me to go to private practice. I think that everyone should work in the service industry or the retail industry at some point in their life, because I think it teaches manners.
It does.
Um, and therapists, I think we should all at some point work in a community nonprofit setting,
Mhm,
because you learn so much. And
mhm,
so my mindset was, I don't want to go into private practice until I know that I have the skills, that I have earned the
mhm.
right to go into private practice.
Yeah, absolutely agree. I love that about you. You never approached the work that you were doing with a high-mindedness. I got this. You were always very um, committed to making sure you understood, you know, you had the foundation to serve. I do agree with you. I think there are a number of people, especially after the pandemic, that leaped into the space, um, maybe prematurely.
Mhm.
Um, and there is an element of dues paying that I believe in due paying dues.
Mhm.
There is an element of dues paying that I do see associated with working in community-based care. If nothing else, a level of grounding around the pain and suffering that exists in general,
Mhm.
and then being able to recognize that um, we can all play a valuable part in helping people get better, feel better, do better, live better. Um, there is an argument about the fact that that service oriented mindset should not come at the therapist's expense of their quality of life. And
Mhm.
I appreciate that as well. I don't think doing good work because you're doing good work, you should have to suffer and struggle. But there are some amazing lessons that I know I learned in community-based care. I didn't serve in the same way that you serve, but I did serve many years in community-based care. I actually went into the homes 10 hours a week for each child that I worked with. It was transformative. And I don't know if you felt this, but I remember when I first started doing that work, I thought, I wasn't prepared for this. Like, the school didn't teach me how to do this.
Yeah,
Did
I
you
did
have
in
a moment?
home. I did in home when I did my internship like in grad school. Yeah, did not love that. It's not
Yes,
fun.
it's very challenging. Very, very challenging. So, with that being said, what's something you wish you would have known before entering the field?
Try and think like what did I not know? Because it's like I've been doing this for not so long
Hmm.
enough that it's like what was oh wait, a couple of things. I wish I knew that to do this work, you do not need a PhD.
Right.
Um, so I had this mindset, and I think it's also I'm very much like a overachiever, high functioning, like anxiety type person, right? And I was like, I have to have a PhD. I have to be Dr. McGuinness. Like that's what I need to do, which that would be fun. But
Right.
and I think I may have told you this back in the day, but I applied to PhD programs, like that was what I was doing. And then after I had submitted all my applications, I had like this like moment where I was like, I don't want to do this. I
Hmm.
only want my master's. I can do
Hmm.
this with my master's. So I ended up changing, I ended up choosing a master's program. But so I wish I understood like the different like levels and
Hmm.
what you can do with each level.
Yes.
Um, I also I do wish that there was a class offered about running a business.
Hmm.
There's nothing, at least I don't know about programs now, but there was not a single class offered in my program that involved running a private practice and
Yeah.
stuff like that. So it is very much like trial by fire. And
Yeah.
I just figured it all out by
Yeah.
meeting with other amazing therapists, who were able to give me some guidance and just doing a ton of research. But like, would be nice to have a class about that because a lot of therapists
Yes.
do end up becoming business owners.
Hmm. Hmm.
Um, I I guess I don't know. I feel like I also I wish I had a little more confidence at the outset because I will tell you one of the things that I've struggled with and I've gotten a lot better with this is I'm not a parent of a child. Well, I've got dogs, but I'm not a parent. And while I'm not super young, I'm on the younger side. And
Hmm.
sometimes I used to really worry going in and talking to parents and trying to give them guidance that they were like, what do you know? Right.
Yeah.
And I've learned by doing this in private practice that really helped me with my confidence. Like parents want their kids to get help and they're open to feedback and they want to hear what I have to say. I used to be like, just, maybe try. Now I'm just like, why don't we try this?
Yes. Yes. That's so good. All of that's good. So it's interesting. The PhD thing, I don't know that I knew that. And it's always interesting to me, and I feel uncomfortable at times when people will say, "Oh, Dr. Simmons, I want to talk to you because I wanted to go get my PhD," and then I'm like, "For what?" And I feel weird saying that because I have a PhD, but I learned some things about that, and my process is different than other people. Um, in this country, we have a tendency to buy into it's just not enough, it's just not enough, what you have is not enough, it's not enough, not enough. And so I find myself challenging that thought when people come, like, help me understand why you want that and
Mhm.
what your goals are, and let's talk about whether or not that's necessary for your goals. I'm trying to bridge that gap for the folks that come after you.
Yeah.
Um,
That's actually, so I had a professor. So I studied abroad in London when I was an undergrad, and I became really close with the two professors. And it was after I submitted all my applications that I had a conversation with one of those professors, and she was the one. Sorry, my dog. He's
it's
having
okay.
a moment. Um, she was the one who was like, why? Why are you doing it for the prestige and the
Right,
title? Or are you
right,
doing it for the work that you want to do? And
right,
also, she's like, don't forget you have to do a lot of research. And I was
right,
like, don't want to do that. And I
right.
wasn't interested in being a professor myself. So I really want to honor like the people you included that have guided me to this place.
Saved you a lot of money. I know you spent some money on applications, but nothing compared to what you would have spent in tuition. And yeah, and I just think that it's important. I didn't have a guide. I don't regret it. I probably would have gone PsyD if I would have researched a little bit differently. But the people who led me down the road, Dr. Gatewood, I think she's still with me, but bless her soul, she's not. Um, I appreciated what they saw, and I see the value in having it now. And in hindsight, I've learned ways to use it differently because I too don't want to be in academia. Um,
Mhm.
I love I love teaching, but just not in academia. So yeah, that that is an interesting point. The everybody deals with imposter syndrome at some point or another. Um, but there was the second thing that you said. Oh, business. I'm shocked. I had a business course, but it was an elective. I didn't it didn't really prepare me,
Mhm.
but that was 2004. So I'm really shocked that hopefully that is changing across institutions nationwide, I would hope, because I mean, now schools are even bringing licensed practice owners in to talk to the students about private practice. So I would hope that that changes. It's definitely a place where advocacy could take place, especially for folks who watch this who are enrolled still.
Mhm.
It would be wise to request with the institutions struggling for enrollment. It's a good time to ask for what you want.
Yeah.
Um,
It just actually made me think another thing I wish I'd known is how hard it is to work with insurance. Oh my goodness, I don't accept insurance because it's far too complicated, it's messy. It's as a clinician. It's also messy
mhm,
as a patient too,
mhm, mhm,
But my
mhm,
goodness, it's so difficult. Why is it so difficult? They make it so hard for people to
mhm.
access quality
Yeah,
mental health care.
absolutely. I mean, if you think about it as a client, just using your own insurance for your own services, it's not easy.
Mm,
Some of the things I've learned as an insurance panel, as someone paneled on insurances, I learned from the other side because of my own health and different things I had to do, the different ways I had to utilize my insurance. I learned some things, and I'm blessed to have a husband who's an insurance agent, so that helps. But insurance can be incredibly murky, and you really have to decide what your value and your model, uh, your business model is to determine whether or not that's what you want to do, which is why coaching is helpful. It's important to have some kind of
mm,
business coach if you're going to jump into private practice. Um, the other thing that you had mentioned that I think is so important is this idea that you were not a mom. You weren't a mom of children. You didn't have children, and you thought you were concerned about your approachability and being able to talk to parents about that. And that's a common um, principle, if you will, whether it's you have children or have you been on drugs or have you've not married. How can you tell me what to do? You never
mhm,
been divorced. People who are a bit defended or guarded and not really sure that they're ready to do the work that they're being called to do. It's one of the areas that you'll see pushback.
mhm,
I do think that's more common in disadvantaged backgrounds where there's a level of suspicion around the healthcare provider and just the whole psychology and counseling as a whole. But when you get a demographic that's motivated, 9 times out of 10, especially the private pay demographic, they're going to look into who you are before they come to you, or they've been referred to you by someone trusted, and usually they're ready to do the work. It's
yeah,
it's a powerful distinction between the demographics and really getting clear about who you're called to serve is going to be important. I say you got to be graced to work with different demographics. And when you're working with individuals who are disadvantaged in some way or who've been marginalized in some way, it really just takes um, a different skill set to build rapport and create trust. And when you
mhm,
do that, you can overcome that defense, right? Or you don't have children, how can you tell me what to do?
yeah,
Uh, Because people really are looking for your heart posture towards them. They really want to believe that they can trust you. And once they do that, whether you have children or not, doesn't matter, or whether you are in alignment with their issue or not, it doesn't
Mhm.
matter.
That's one of the really awesome things I'd say is um so parents will bring their kids to me, right? And so a lot of the parents are like pro therapy, love it, they're in therapy themselves. But there are a number of parents that bring their teen to see me and they are therapy's a joke, therapy doesn't work, right? And I just think it is the coolest thing in the world that a parent holds that belief but sees that their child has a need and they're willing to try this thing that they think is a joke and isn't real. And I'm like, that's you are being a great parent because you are
Yeah.
putting your child's needs above
Mhm.
a belief that you hold, right?
Absolutely.
And a lot of times that their mindset changes because they see
Yeah.
the progress. And I just think that's so cool.
Yeah, it is. It is. I believe that most, I won't say all, but I believe most parents, for the most part, parents just want what's best for their children. And it's a very difficult thing to not be able to give them that. Like you bring a child in the world and you envision that that's your responsibility to meet their needs. And when you realize that you've hit a limit, a personal limit, you have to confront yourself about whatever that is, whatever situation they're in, whatever they've been exposed to, whatever you didn't protect them from, whatever you did or didn't do.
Mhm.
It's hard. And honestly, when parents are resistant, it's usually that. It's coming to terms with the fact that I don't have, I am no longer capable of doing whatever's necessary to get the result that I'm looking for with my child.
Mhm.
And that's a loss and sometimes seen as a failure, and now they got to deal with themselves. So um but you can't work with children without working with parents. Anybody who thinks that you can work with children without working with parents, it's a little it's, you got to be careful, because you if you're not careful, you scapegoat the child, right? The child,
Mhm.
now the child's the problem. And so when I'm working with other clinicians who work with children, because I don't work with children, I strongly encourage some kind of connection with the parent, because they're with the parent more than they're with you. You got them for what, 50 minutes every week, or if you're good, um, and maybe every other week for some. The
Yeah.
parent, that buy-in is going to be really important. And I think when you do your job well, you're able to get that buy-in. They're like,
Mhm.
"What are you doing, Miss Caitlin? What, what? It's something's changing," and now you build credibility with them.
Yeah, and I think that
Uh-huh.
that's it's an art form. I'll tell you,
Uh-huh.
working with teen, it is an art form because trust is so important. Therapy is not going to work if you do not trust your clinician. And
Mm-hmm.
I am very big, and I let parents know at the outset, I'm not going to tell you what we talk about in
Mm-hmm.
session.
Mm-hmm.
I will give you general overviews.
Mm-hmm.
And when I share something specific, it's because I've asked permission of your child
Mm-hmm.
to share that
Mm-hmm.
with you. And
Mm-hmm.
so it builds so much autonomy and
Yeah.
self-esteem in the teenager
Yes.
that they have a say in what I tell their parents. And a lot of the times they're like, that's completely fine. Please, I would like help with this, right?
Mm-hmm. Mm-hmm.
Um, and so that it's like I said, it's an art form because you want to make sure the parents are buying in, they trust you, they feel
Yeah.
that you have their child's interests at heart,
Yeah.
best interest at heart. But you also want the client to know that you're not going to go tell mom every
Absolutely. This is
and I
absolutely.
unfortunately have heard from clients that previous therapists do go and tell their parent things that they did not agree to be told. Or I hear from parents that they brought their child in for the intake and then they never heard from the therapist again. There was no like checking in. And
Yeah.
so it really is, you have to find the balance between sharing, some stuff with the parents, like the general overview of progress,
Absolutely.
maybe some skills, right? You want to help
Absolutely.
the parent learn to
This
regulate
is
as well.
this is what we worked on today, right? Like we
Mhm.
learned this, we learned that. this is, this is what you can expect. Or even an invitation for a family session if maybe the child needs some help, whatever the case may be. But you're right, it is an art form, understanding just how much to hold, understanding how much to share, how much to transform. Sometimes children's perspectives about things are skewed and they need a little clarity. One of the questions that I would ask regularly is, who told, like, did your parent tell you that, or is that your interpretation of what
Mhm.
happened? And maybe there's an opportunity to get some clarity. um so I know that you trained in a trauma modality, but I'm curious about your um your experience with trauma. Like, what led you to recognize the need to get additional training?
Yeah, so with the like I said, I always knew my path was going towards working with survivors of sexual assault. And I really don't know, maybe it's Law and Order SVU, right? I used to binge that when I'd stay home from school sick, right? I don't know. And of course, I mean, I was a teenage girl. My friends were teenage girls. Things happen, like things that shouldn't happen,
Hmm.
right? And women just, men as well, but women are just highly, highly victimized. So I just always was like, no, I got to do something. I got to help
Yeah.
people. And then I always knew I was going to do that, but I was like, all right, let me get my general stuff done. And when I was working with the nonprofit here in Florida, a lot of those girls had experienced trauma.
Yeah.
And so I knew I wanted to get some sort of higher level. I remember part of my imposter syndrome was like, I can't call myself an expert until I have been like have gotten a special training, right? And Pesci is great, but I don't feel like Pesci offers like a specialty training. So I'd done
Yeah.
Pesci stuff, but um, and I remember I went to FOMCA, the Florida Mental Health Conference
Hmm.
Association thing, and there was a table there, and there was this organization representing accelerated resolution therapy. And I talked to them for a few minutes, and I don't know, I just kind of decided right then and there, I was like, this is what I'm going to do. And so I did the research and I got in touch with them, and I got in touch with the people on my team at my nonprofit, and we were able to work out a nonprofit group discount. And I organized ART to come do a training. And so I got basic trained in ART, or accelerated resolution therapy.
Yes.
Did that, COVID happened. That was a that kind of slowed down my getting to the next level. Once COVID kind of cleared up, then I got master trained. And I have been using that, and I use it for not just sexual trauma. I use it for
Sure.
anxiety, depression, self-esteem, grief, OCD, ADHD, dyslexia, so many different things. But I definitely use, like, people will refer, like other therapists will refer clients to me just for the short term to
Yep.
help them get past this like wall they've hit
Yep.
due to a trauma.
Yep.
And it's the coolest thing. I think there's tons of great modalities for trauma. And I think
Hmm.
sometimes people get a little competitive, like, mine's the best. I don't buy into that.
Yeah.
I want whatever's going to work for the client,
Absolutely.
whether it's EMDR, brain spotting, ART, whatever it may be.
Absolutely.
But ART has been really, really cool, and seeing my clients make progress. And it's not magic. It's not like you wake up and you don't have any fear or any anxiety about something, but it's manageable.
Yes.
You
Yeah.
couldn't go to that place where the bad thing happened. Now you can drive past it. Your
Yeah.
heart might speed up, but you go past it instead of avoiding it. That's
Yeah.
huge.
That's great. You're right. I have noticed a little competitive nature around that's bred in all, just in our country, we're competitive in that way. But I do tell the individuals that I supervise regularly, when you're clear about who you serve, then you can research what modality seems to be effective for that demographic, and then go get that training. And whatever that is, whatever you decide is going to be great. Ultimately, I think whether it's brain spotting, EMDR, ART, or some other um, a non-narrative form, brain body based modality we know is effective for helping people who have had trauma and significant mental health complications, and pick one, right? You know, pick
Mhm.
one that feels better to you. When I used to work at the trauma center locally, um, we had clinicians who were trained in both. And then so I would ask him, like, so what are your thoughts? And some really liked EMDR for some of the structure that it had, and then some really liked ART because of, I think it's somewhat modified in some way. It's not, it's extensive. I don't think the training was as extensive or lengthy. There's something about the approach was felt shortened if I understood them accurately. I am not trained in either. I chose not to do that. And so I do also refer folks out specifically for that. Like, uh, I think we hit a wall here. It'd be good for you to speak with someone. So that is a very common practice for clinicians to partner with other clinicians to be able to get their clients to do well. Post COVID, any themes you saw spike, change?
Mhm, mhm,
Share a
mhm.
little bit.
Number one, I exclusively offer in-person sessions, and that is because a lot of clinicians have moved virtual. I've never been a fan of virtual with the population I work with. I think that young people are losing some of their social skills,
Mm-hmm.
and that is all of the use of video technology is contributing to that loss of social skills. So
Mm-hmm.
I can't get the same connection if we're talking over a video. So
Mm-hmm.
that's one thing. But I also have noticed people seek me out because I only do in person. And a lot of these kids, they're craving it. They actually
Yes.
want that in person. They don't
Yes.
want it online. Now it
Yes.
works better for some people, and there's tons of options for that.
Mm-hmm.
So
Mm-hmm.
that's one trend. I believe anxiety has become an epidemic amongst young people. That's a huge thing. I mean, COVID really, really, really had an impact. I would say, I mean, I don't have the research to back it up, but I would say if you were between the ages of 10 and 17, when at 10 and 18, like if you were in high school, when COVID was at its height, you are very likely to have an anxiety disorder.
Uh-huh.
Um, Again, generalizing, but it is something about the brain development of adolescence and what happens, seeing all the adults around you panicking,
Yeah.
panic buying, watching the news 24/7, just seeing statistics of people dying, like all of that. And we look to when we're kids, we look to the adults for guidance. And when
Mm-hmm.
adults are like, I don't know what to do, it really destabilizes us.
Yes.
And so I feel like younger than 10, there was some padding, like a lack of understanding of what was happening. You could just distract with toys, but 10 and up, you had the wherewithal to know something's wrong. So I think that that's really caused a big shift in anxiety, self-esteem. Adolescence is already a time where we're highly aware of what we look like. We're very
Mm-hmm.
judgmental of ourselves. We think everyone is watching us. And when we were able to wear a mask, it was a security blanket. It was like, well, if as long as my eyes look okay, nobody can judge what else is
Mm-hmm.
happening in my face. So
Mm-hmm.
acne, braces, if you
Mm-hmm.
don't like the way your face looks, a mask covered it up. And I think I saw a lot of people, and I'm still seeing people struggle with going. No, Siri, with going out in public. So self-esteem was really impacted.
Mm-hmm.
And this isn't so much a COVID thing, this is just a society thing, but social media.
Yeah.
I see a lot of trends of self-diagnosing.
Mm-hmm.
I see a lot of trends of it being trendy to have a severe mental illness. It's
Mm-hmm.
as if having anxiety or depression isn't enough, right?
Right.
That's not going to give you enough clout, enough recognition.
Yeah.
So maybe you have a borderline personality disorder or dissociative identity disorder. I can't speak today. Um, or some other more like severe mental
Yeah.
illness. Tourette's, right? And I go on TikTok sometimes 'cause I'm just curious. I'm like, what are people seeing? And I see some of the most ridiculous videos glorifying these mental illnesses. It is actually so hard to live with these diagnoses. Nobody wakes up and says, I want this,
Yeah.
right? And it kills me to see a trend towards identifying with a diagnosis that you don't actually have. But I
Mhm.
know that it's serving some need.
Mhm.
Something isn't being met. So you are attaching to this diagnosis to get a need met, and I get that. But
Yeah.
it is something I think TikTok has really contributed to.
Yeah. I don't have TikTok, so I'm ignorant in that realm, but I do know that I that social media has a huge impact in what we're seeing. And I agree 100% about the fact that our young people's social skills are diminishing. I don't think it's hopeless, but I do think that we have some to rethink how we support young people. Um, and I love the fact that you made an active decision that how one of the ways you would do that is by being in person because they do. As I was listening to you talk about the pandemic and some of the themes that you saw, many of them are concurrent for adults.
Mhm.
I cannot tell you how many adults are barely going to grocery stores. We've made everything convenient. And so it's like I DoorDash this and I Instagram this. I mean not Instagram, look at me. I
Instacart.
Instacart this and and it's like, really? Like you're still not comfortable, but they won't say that they're uncomfortable. The ease of accessing the things that they want without the human interaction
Mhm.
has just become more desirable. So it will be interesting to see what trends show forth in the next 5 to 10 years. But nevertheless, what's next for you? Anything specific on your radar?
Mm, not particularly. So I guess I'll give a little bit of my history with private practice. So when there was a time where I was working like three jobs at once. Don't miss that time. So I was doing my nonprofit work. I was doing comprehensive behavioral health assessments on children in foster care who had been removed from their parents. And I was doing private practice part-time. Private practice ended up being, amazing. So I decided to just do that full time, but I've only been doing that full time since July of 2021. And I joined a group practice, True North Counseling, with Kim Herman, formerly Kim Martinez. She was such a help in getting my feet wet with private practice. And I was there for about a year. And then it was actually January of last year that I went out completely on my own, got my own office and everything. And so I kind of feel like I'm still in that. I'm doing this completely on my own and I'm really enjoying it. And I don't want to rush into the next thing because I feel like eventually I'll reach a point where I'm like, okay, what else can I do?
Yes.
So I'm kind of savoring it, but I do have this goal in mind. I don't have a set date. It's very, very much like not a smart goal at all. But at some point, my husband and I have talked about how cool it would be to buy commercial property and make it like a health hub. So now I don't want to own a practice. I don't want to have people under me, but get a group of like-minded individuals in fields that complement one another, right? So therapists, psychiatrists or psychiatric nurse practitioners, dietitians, occupational therapists, right?
Mhm.
If I could have a commercial space where it's kind of like and maybe it is for teens and young, I don't know, that's too far ahead. I gotta get there. But how cool would it be to own that? And I'm the landlord, right? And my office is also there.
Yeah.
And that's passive income because people are paying rent.
Yeah. I love
But
it.
it's also like I would want to like really, again, I don't know all the logistics of it, but I would love it to be like-minded
Yeah,
individuals, people who, I wouldn't want like, I don't know, like I can't like a sewing, like a knitting factory in one of the, like it would have to be like
yeah,
similar
yeah. No,
things.
you had it an integrated health, health and wellness space,
Hmm.
where you specifically reach out to targeted industries. That I think that's common. It's um integrated health is more common than it used to be,
Hmm.
and more wellness professionals are learning how to connect and partner now. It makes sense because you have a captive audience, right? And so no, I love that. I look forward to hearing about that when you do that. So how can people find you?
I'm on Facebook and Instagram. On Facebook, it's Caitlin McGuinness Counseling Services. On Instagram, it is CM Counseling. No, sorry, Caitlin McGuinness. Let me look. I should know this off the top of my head,
No,
shouldn't I?
this happens to me as well, so no stress.
I also have an obnoxiously long name, and I decided to keep my name as my practice name. I don't know why I decided to do that. Um, but my Instagram name is Caitlin McGuinness Counseling. But then my website is CaitlinMcGuinnessCounseling.com. So those are all the ways to find me. All of them are going to link back to each other. So if you can remember one of those, you'll
Perfect.
be able to find me.
Perfect. Perfect. Wow. That brings us to the conclusion of our time with Caitlin McGuinness. Thank you so much, Caitlin, for sharing your journey. This is Dr. Shanae at the Collective Wellness Institute. I have qualified supervisor, had the beautiful opportunity to start with this wonderful young lady. And as you see, she is dynamic, full of just depth and commitment for um, our young people and the industry. And so, if you have any additional questions for her, please reach out to her. Again, she runs a in person. That means you have to come in, you have to leave your house and go to her office. And that is in Carrollwood, no?
It's in Lutz, so it's it's
Lutz.
it's right on the cusp of Tampa, Lutz, Carrollwood. Um,
Perfect.
yeah.
Perfect. So you heard it. She's private pay in person in Lutz, like the North Tampa area,
Mhm.
and works with young people from
Yeah. 12 to 30.
12 to 30.
Mhm.
Yes. All
Mhm.
right. Again, this is Dr. Shanae at the Collective Wellness Institute. If you have any questions about qualified supervision, you can reach me at Dr. Simmons at communityvictory.com. We trust that this was informative. There's something that you can take away. And again, if you're looking for someone who can work with you or your young people, please see Miss Caitlin. Have a great What's today? Thursday. Oh my goodness, we're on the edge of the week. So
Mhm.
everyone have a great rest of your week. Enjoy your weekend and stay tuned for the next. I don't know who's next. I have to see. Stay tuned. Just stay tuned. All righty.